Hi. So tonight's gonna be the longer video of differentiating diagnoses, since both medical and mental health doctors or providers are taught to do differentiating diagnoses. The only problem is they don't look at the other diagnoses from the other side. Like, mental health doesn't look at other possible diagnoses in the medical side of things, and the medical side doesn't look at diagnoses from the mental health side. I learned this just recently myself, even though I've learned it before too. But most recently, I was doing an online assessment for a mental health condition called dissociative identity disorder, because I think I have that. By no means am I saying self-diagnose, because that gets tricky too. But I took it because I have an upcoming psychological evaluation on May 18th. And I just wanted to prepare for that and show that provider what I found out. But in that assessment, you are asked questions about seizures without any known medical reason. And it said that I possibly have psychotronic non-epileptic seizures, but it didn't say look at the possibility of the person having epilepsy, which I have epilepsy, and I just answered yes because I have not been evaluated yet for my most recent seizures. So the assessment is a little misleading in the questioning, and I didn't know how to answer it properly. So I did what I knew was honest, but it didn't say possibly could be due to epilepsy. And that's frustrating when doctors see these assessments and don't think about the other possible medical or mental diagnoses. They just go based off of what they know in their training. So that's very frustrating for me as a patient. And I'm sure it's frustrating for other people, other patients as well. Um, it's just hard because I'm trying to do what I think is best in preparation for an upcoming appointment. But at the same time, there's like seeing the thing about psychogenic non-epileptic seizures is just so frustrating because that was not what I took the assessment for. So I shouldn't even be asking, in my opinion, about seizures at all. Um, so, and another thing is like, not all seizures, like I said before, show up in EEGs. Um, so because there's 40 different types of epileptic seizures, so that's even more complicated than what this assessment has shown. I just wish like providers on both sides, both mental and physical health sides, would look at a person as a whole person, not just as a patient just for mental health or just a patient for physical health, but as a whole person that is a complex person with complex issues. And that could explain what's going on and why they might have answered an assessment question in a certain way. Yes, I just wish that doctors would actually be more open to looking at the complete picture of the person, not just the psychological part or just the medical part, but psychological on medical in one. And that is really hard because I shouldn't have to think about the complexity of my own diagnoses that I do have and what causes me to answer the question in some way because I don't understand the question necessarily. And that frustrates me even more. So I'm just really annoyed at the system, both medical and mental health wise, for this in this regard. And to other patients, please speak up for yourself and mention why you did an online assessment and why you answered a question in a certain way on that assessment if you did take one, and let the provider know that you didn't do it to do self-diagnosis. You just were curious what it would show, and that was my case. Because if I didn't take this online assessment, I would been anxious about this psychological evaluation that I have coming up, and have been made it even more difficult to sleep than I already have, and I didn't need extra anxiety keeping me awake at night, because right now I have that anxiety about the medication and the epilepsy monitoring unit stay that still has not been resolved. So that's it for today. I will see you again tomorrow. Thanks. Bye.